Welcome, welcome, welcome back, my Be Health Empowered family, to another week of Excuse Me, Doctor. This is Dr. Mel here, live. I am delighted to be back here with you this week. You know, we're here every week doing what we do on Excuse Me, Doctor, which is bringing you the information that you need to make wise health decisions, not just for yourself, but also for your family and for your community. So thanks so much for tuning in to Excuse Me, Doctor, regardless of the platform that you're watching us on or listening to us on. We love you. Thanks for tuning in. And if you're newbies to the show, please remember, if you're on YouTube, please hit that subscribe button. And if you are on Facebook, please hit that like button. We really appreciate you for it. And super important to remember, this is really, really important to remember. Make sure that you put those questions and concerns and opinions in the chat. We want to hear from you. You are the reason why we're here. We're here to answer your questions and hear what's on your mind. So let us get into creating that amazing week for ourselves with all the health topics we're going to discuss today. And to do that, I have to have my ride or dies, my co-hosts, Wayne and Larisha. Where are y'all?
There we are. There we are.
Hey, Dr. Mel.
How's it going?
Mel. How's it going?
Yeah, how's it
It's
going?
going great. How's it
Good.
going with
Well.
you? How's it going with you, Dr. Mel? Are you good?
It's going good. I'm just trying to keep cool in this heat. I'm just saying.
I don't blame you. I do not blame you. I'm excited to get outside. I'm going to get in the water sprinkler at my baby's tomorrow.
Okay.
So, you know, I'm ready. I'm ready.
That sounds good. And I hope everybody is hydrating, and keeping cool too.
Yeah, I was on the golf course, Dr. Mel, and so I had golf hat hair. So
I see. So you just walk right into the studio
on air,
straight off the golf course with the hat on. I'm just
straight off the golf course. No, actually not straight. I mean, but pretty much, yeah, straight off the golf.
Okay. All right.
But it was hot and I was hydrated. So
well, good.
I'm cool with it. I'm cool with it.
Yes, and I walked 2 miles in the shade, but I stayed hydrated. So
in the shade,
that's important.
How'd you walk 2 miles in the shade?
In the woods, in the path. In the woods.
Okay.
There my walking group.
She had the trees.
I had the trees. Thank you. Yes.
You know,
the shades. So what are we talking about today? What is our topic for the week?
So today, Dr. Mel, we are talking about heart health. What are things that are putting your heart at risk? Are there unique stressors or genetics that affect some of us or others? And what can we do about it? Is there anything that we can do about it? Preventative methods, whatever it might be, we are discussing heart health. And to help us with this great community discussion, we have two incredible hosts. One is a cardiologist who is the head of the Eastern region of the AHA,
the American Heart Association. Yeah,
I know.
Say
I'm
that
trying
3
to talk
times
so
fast.
fast. No, I can't do that.
Too fast.
But our other guest is someone who has dealt with heart issues and is here to share, his experience firsthand. So I'm excited about our guest because this is such a unique and great topic for us to discuss, especially since I know that in my family, we've had certain people who dealt with heart issues. So I'm excited to hear from our guest.
Absolutely. Yeah. And I know a lot of folks out there, either if they haven't personally, they have a loved one or a friend who may have had a heart attack or is at risk for having a heart attack. So please share right now. Stop what you're doing. Share this episode with the folks that you want to hear it. And remember to put those questions in the chat.
Share and put all your questions in the chat. It's really an important discussion for men. So wherever you catch this broadcast, whether it's on the podcast, whether it's on the radio, whether it's on YouTube and all the outlets, get it to the brothers, get it to men, and make sure men know about the risk that they could be facing with their heart health.
And it's for everybody. It's for everybody, but we're gonna talk. We're actually gonna ask the cardiologist, Dr. Robinson, about, do men have a greater risk than women? So we'll see if what you're saying bears out.
I'm with that. So before we do that, Dr. Mel, you know what, we got to recap all the news and health and wellness since we last spoke, right?
Yeah, right.
Here we go.
Absolutely.
Here we go. Here we go.
Here we go. So we're going to get started with this question, you guys. Is COVID causing more childhood diabetes? Now, we've seen that there has been an unusual rise in the number of children and teenagers around the world diagnosed with type 1 diabetes since COVID. That, according to researchers, and they're also saying that more than 38,000 young people have been diagnosed. They were diagnosed rather during the pandemic. That is a mind-blowing number. So true or false, is COVID causing more childhood diabetes?
So this is a thing. I know people are tired of hearing about COVID, but there's this thing called long COVID that is causing all these symptoms that, are just being uncovered. And so there's been this increase in type 1 diabetes. Remember, type 1 is not the diabetes that you get from lifestyle things like eating too many carbohydrates and being sedentary. It's an autoimmune disease that attacks the cells of the pancreas and shuts down the pancreas from making insulin. Wow. And so they've seen, the rate of new cases was about 3% pre-pandemic. It shot up to 27% rise in cases by the second year of the pandemic. So that's really significant. And it's not clear whether it's the coronavirus itself that's damaging the pancreas or causing some reaction that's damaging the pancreas, or if it's that the kids were not interacting with each other and picking up bacteria and viruses that may have had a protective effect that we have yet to understand. But whatever the issue is, that it's really important. Watch for signs. And if you see these 4 T's in your children: tiredness, thirst, toilet trips to urinate, and thinness or weight loss. Those are the 4 T's. If you see those in your kids, definitely take them to the doctor, because early diagnosis is really important in type 1 diabetes.
Do you have to see them all together, or can they be separate, Dr. Mel?
It's really that combination of factors that, are most likely explained by type 1 diabetes. But if any of those things, excessive thirst is happening, more urination, fatigue, any one of them, weight loss is not explained, those should be individually reasons to take your child to the doctor, to their pediatrician.
Is there any specific age group that has been affected more than another? Do you know, Dr. Mel?
Yeah, they just really looked at all kids under age 18. So it was the pediatric database in general.
Got it.
Fantastic. Yeah. So, everything has been happening. We even it's mosquito season in certain parts of the country. And we now have cases of malaria in Florida and in Texas.
Yeah, so the CDC is warning everybody be in prevention mode. 4 cases in Florida, 1 case in Texas of malaria. Everybody survived, but this, malaria is carried by mosquitoes. It's a parasite, and when they bite you, they can infect you with it. It causes fevers that don't go away, headache, body aches, chills, and severe cases can even be life-threatening. So it's really important to, just practice safe mosquito hygiene.
So we should all cover up, use mosquito repellent, drain, standing water, all the things that you're supposed to do, we should be doing.
Right. Because mosquitoes breed in standing water. So you want to drain all those areas if you can around your house and your property.
And that is so hard right now, especially for where I live, Dr. Bill, because it has been pouring, raining almost
Yes.
every day here in Georgia.
Yes.
And so the
Mhm.
puddles are just piling up, and those mosquitoes are just getting worse and worse. And I promise y'all, they are getting bigger and bigger.
Mhm. Well, use that repellent. That's important.
So
Well,
can we use repellent with DEET in it? You remember they were saying don't use DEET,
Yeah.
DEET, right?
Yeah, I wouldn't recommend it for children,
Okay,
especially the ones that have heavy DEET in them. Yeah.
okay.
well, can we use mosquito repellent to also help with weight loss at all? Because
No.
some people are using weight loss pills, but that might not be a good thing to use for a long time, Dr. Mel. So I'm just trying to think of some
Well,
other alternatives here because
well,
some of
I
this
think
baby
you
weight is
might
still sticking.
I think you might be talking about that next thing about weight loss medication. So we're talking though about Ozempic, Wegovy, and this third one that is waiting in the wings. It's in phase 3 trials. It's called retatrutide, and it's showing even better results than Ozempic and Wegovy. Um, but if you start to take them, you kind of have to stay with them because if you don't, the weight will come back. And what's happening to people, like if they switch jobs or they lose their insurance coverage and they end up with another insurance that doesn't cover it, they're finding out that these things are $1,400 per month to stay on this medication out of pocket. Yeah.
So
And
you
so
basically have an apartment rent to stay small.
pretty much. And so what's happening is they're seeing that people who don't continue on it, the weight comes immediately back, you know?
Wow.
And so just important to remember that you can't just rely on the pill, that it's also lifestyle changes along with the medication. And you know, just realize that if you do start it, it's a commitment.
So someone has to sit there and sing the Ozempic for a long time.
For a long time. And keep in mind, a lot of people are just getting it because they want to lose weight, but there's specific criteria that insurance companies look at. You have to have a BMI over 27. And so, for example, average height woman, 5'4", that's around 160 pounds. And if your BMI of 27 to 30, you have to also have a weight related condition like high blood pressure, diabetes. Or if you have a BMI of over 30 or over, you don't have to also have a condition. Just the BMI of 30 is enough. And that's an average height woman of 175 pounds or above.
Well, technically, I qualify because everything that you said is coming from a chart that I know says that I'm a little overweight.
Yeah, but BMI can sometimes be misleading. So you also have to go by weight circumference too, because if you are athletic and you have a muscle mass, that's going to throw off your BMI. So,
Okay, thank
talk
you.
with your doctor about sort of your ideal, um, uh, uh, weight range for your height and build.
I'm just kidding. I don't need Ozempic. I don't want to sing that.
I didn't think so. I didn't think so. I'm just saying.
Look,
Well, now it's time for us to move into my favorite portion, my favorite segment, y'all.
what's it?
What y'all think?
So this has been in the news lately, and it's also been the talk, like a trending topic on all of social media. Cultured chicken, aka chicken created in a lab. Are you guys ready for that instead of chicken from our culture? So there's about 9 billion chickens that are eaten yearly. And to lower that footprint, the USDA has given the final okay for chicken fully grown in a lab to be sold in some restaurants. Now, it hasn't quite made it to the grocery store, but there are two companies, again, who are trying to work to bring it to the market and in more restaurants. Are you guys down to try the lab chicken or the
Put
cultured chicken? What
put it
y'all
in the
think?
comments. Put it. I want to read the comments on this. because I got a complete hell to the no on this one. I'm sorry, Dr.
Why does that
Bell.
not
I know
why
this
does that
is your
not surprise
show.
me?
I got a complete hell to the no. I'm not trying a culture. I don't even want to try steroid chicken. You know, some. Remember, it was the rumor going around that some people with steroid had really big chicken, really big fried chicken. I don't want to name the company, but you know,
Oh yeah,
it was like a
Right.
company, like you would visit them on Sunday. It was like if you went to a place on Sunday that had, I don't want to go into it,
No,
but they were
no,
rumored to have
no.
steroid chicken. I wouldn't try
Well,
that.
I hear you. You're a chicken purist. So we'll
My
see.
chickens
We'll see
got to
how
be
many people have.
organic and
Right.
cooked by
We'll see.
somebody's grandmother. She has to have a flap hanging under her arm.
What?
She has to be able to shake the chicken and the flap go. That's who I want cooking my
Okay.
chicken. That's whose chicken I'm eating.
You
Just
want to go
saying.
back to your childhood. Okay, I got you with your chicken. You're a chicken purist.
My grandmama had a big old flap. I'm just saying.
Okay.
Love her. Rest in peace, grandma. The
Oh
best
my
chicken.
goodness.
Right.
Oh,
Well, we would love to hear what everybody thinks. I'm sure everybody's going to have an opinion on this one. But thank you all for what y'all think and for the recap. We are going to get back to you later in the show. But now we are going to move into our main topic for tonight, which is heart health and what is putting our heart at risks. Um, you know, when it comes to heart health, there is a question, just because it runs in my family, is it something that I'm going to get? Are there things that I could be doing? What puts me at risk? What do I need to know to protect my heart? So let's talk about heart health with our two fantastic guests tonight. First is Dr. Reginald Robinson. He is a board certified cardiologist in Washington, D.C., who practices at MedStar Hospital. He also has offices in Maryland, and he specializes in general cardiology, treating heart arrhythmia, high blood pressure, cardiovascular disease, and other diseases of the heart. He is currently the board president of the Eastern States Board of the American Heart Association, and that covers 30 local boards stretching all the way from Virginia up to Maine. Thank you so much for joining us, Dr. Robinson.
Thank you for having me. I appreciate that.
Absolutely. And then we also have Mr. Frank Griffith. He's currently the engineering manager for Mozilla. They're the ones that make the open source Firefox internet browser that I'm sure everybody's seen. Frank is an avid cyclist. He's logged hundreds of miles a week, participated in multiple bike tours, but he's going to share his story of going through a heart disease scare, ultimately requiring a heart bypass surgery. So we're going to hear from Frank Griffith. Thank you so much, Frank, for joining us.
Thanks, Dr. Mel. Thanks for having me.
Absolutely. Well, I'm going to go to Dr. Robinson first. Dr. Robinson, can you tell us, we talk about heart health, and specifically we're actually talking about heart attacks, protecting our heart from heart attacks. What is a heart attack and what leads to it?
So great question. It's a broad question. I'm glad you narrowed the focus, because when you talk about cardiovascular disease, that could include diabetes, high blood pressure, atrial fibrillation, stroke. But when you focus on heart attack, or we call myocardial infarction as a scientific term, I like to use a lot of analogies. So when a patient comes to see me and they're, say, 70, and I would ask them, if you go into a 70-year-old house and cut the plumbing open, you're going to see something in that plumbing. It may not be at a roto-rootering stage at that point, but at some point, if you continue to pour the grease down the drain, where your grandmother used to say, don't pour the grease down the drain because it's going to clog it up. That's the process that's going on throughout your body from head to toe when you think about your vessels, something called atherosclerosis or plaque buildup, like that rust and buildup that goes in your pipes when you open it up. The same thing goes on in your heart. So a heart attack would be an abrupt closure of one of those arteries to the heart. There's several main arteries, and they branch off into multiple arteries. So it depends on how big the area is and how much territory of the heart it affects to cause the heart attack.
And what happens when the blood supply to the heart, to the heart muscle itself gets cut off?
So think of someone putting a tourniquet around your arm, trying to draw blood, right? The longer they keep that tourniquet up on your arm tends to go numb because you're not getting blood flow there. So just like the brain, time is of everything when you start having symptoms and knowing what those symptoms are so that you can get into the hospital in an adequate time so the muscle doesn't die off. So if you're not getting enough blood supply to the heart, we like to say that that door to balloon time, where they're putting a catheter in, putting stents and balloons, somewhere between 90 minutes, they pushed it out a little bit, but trying to get in as soon as possible so you can reestablish that blood flow.
Mm-hmm. And you mentioned the symptoms and knowing what the symptoms are. What are the symptoms, and do they differ between different groups?
Well, one, you mentioned, you talked about diabetes earlier on, and diabetes, they may not have the crushing. I'll say what the typical symptoms are: crushing chest pain, someone sitting on your chest, radiating up to your jaw, down generally your left arm. And a lot of those symptoms can be more at rest or when you're exerting yourself and you're starting to get the chest pain versus if you ate a big steak and you start getting chest pain, you belch or you drink something and it goes away, then that's probably more digestive. But when you think about the symptoms of a heart attack, classic symptoms: squeezing, tightness, heaviness, pressure, radiating up to the jaw, down the arm. Women may have more subtle findings. It may be that you are doing your day-to-day activities and all of a sudden you become short of breath doing those same activities. Diabetics may also have the more subtle findings. So just really knowing your body, that exertion relationship to something that's changing in your body, just pay attention to those kind of things. It could be just shortness of breath all of a sudden.
Yeah. And I think this is a great time to bring in Frank, because tell us about what you experienced that made you concerned about something going on with your body, something that was off.
Yeah. So I'll rewind to early 2017, March of 2017. I had actually come back from a dinner with a number of my co-workers to celebrate one of our VPs leading the organization. Came home that night, nothing unusual. Went to bed, and probably about 1:30, 2 o'clock in the morning, had what Dr. Robinson explained earlier: very heavy pain or weight on my chest. I was feeling nauseous. Didn't have any pains in the arm or anything like that, or no sharp pains. Just very heavy pressing against my chest and nausea. Wouldn't go away. My wife and I proceeded to the emergency room, and I'll shout out Holy Cross here in Germantown. And after a series of tests, for a while they couldn't find anything. That was a Wednesday night. Proceed into the weekend where I was under observation, and it wasn't until they did a nuclear stress test that they saw something abnormal on the bottom of my heart. Now, mind you, up to that point, I had done the Seagull Century, 100-mile bike ride, the previous October. I had put in about 800 miles on my bike the year before. So most of the cardiologists that were consulting, they were willing to let me go home. But up until that point, having the nuclear stress test, that was the first indication that I was having issues with my heart. A couple of transfers to other hospitals, getting through some additional tests. They did eventually find 3 blockages, one that was between 25 and 50%, one that was 50% blockage, and a third that was closer to 75% blockage. Proceeded on to a bypass, and they found a 4th blockage. So in the end, I had a quadruple bypass.
And bypass meaning that they substituted out the blocked arteries for arteries that were open, I'll say. So,
Correct.
so Dr. Robinson, based upon what Frank is describing, he said that, they were almost going to let him go until they did something called a nuclear stress test. Can you maybe piece together some of what he's saying and explain what a nuclear stress test is and what they may have found that made them concerned?
Okay, so I wanted to give another analogy about that bypass. If you're riding down the street and there's someone blocking the street, you have to bypass it to continue on. So that plaque is still there. they just go around it by sewing either an artery from the inside of your chest or taking a vein from your leg and bypassing the blockage itself. And Frank that did something that, it sounds simple, but many men in particular will just stay there and lay at home and say, I'm going to drink some Gatorade, or I'm going to drink some ginger ale and, see if it goes away.
Pepto-Bismol. Yeah.
Let me keep it off, see if it'll go away. And that sounds crazy, but it happens all the time. And particularly in us, we like, well, I'm not going I got to go to work in the morning. But if you can't get to work in the morning because you die from a heart attack that night, then that's a lesson learned. So he absolutely did the right thing and didn't wait to go to the hospital. And back to my analogy about the plumbing, you may not be at the Roto-Rooter stage. He wasn't at the Roto-Rooter stage when he rode his bike. That plumbing to his heart was open just enough. It could have been 50%. And that's why a stress test is not a good screening test for anyone. Frank was doing a stress test every day on his bike, really, right? He pumping that blood flow through the arteries. And as long as that artery is not 70%, he's not going to have the symptoms. All it takes is that plaque to rupture or clot to break and immediately cause his symptoms. So that's what generally happens. Something stable becomes unstable for a number of reasons and blocks the blood flow to the heart. So he did everything right. So I hope people listen to that and do those same steps.
And what's a nuclear stress test? Why was that able to pick up his condition as opposed to the other things they had done before, like an EKG or, like you said, a regular stress test where you just get on a treadmill?
So before you even get to the stress test, the nuclear stress test, he probably had several blood tests done to look at what's called troponins or cardiac enzymes to see if he actually did some damage to his heart muscle. They'll usually do 2 or 3 of those. They'll look at one and see what the level is. And then if they do the next one and it's higher, that lets you know that there's been damage to the heart muscle. And you might be able to just bypass a nuclear stress test and go right to the angiogram where you're looking directly at the arteries. So the nuclear stress test is much more sensitive than a regular treadmill test. You get an IV, we give you a tracer that goes to your heart muscle and other live tissue. You won't glow or anything like that when you think about nuclear, and it runs out of your system over 24 hours. So it's a non-invasive way of looking at blood flow to the heart. So he got 2 pictures, one at rest, and then they may or may not have put him on the treadmill for the second test, part of the test. If they were worried about a heart attack, they probably didn't put him on the treadmill. They gave him a medication that simulated what the arteries would do with exercise, and then gave him a second dose of the same nuclear tracer and took pictures. So they would compare the before pictures and the after pictures to see if there's a difference. If there is, then it leads to the next step that he had, the angiogram.
Mm-hmm. Got it. And that it showed most likely that he was having some area of lack of blood flow while under stress to a part of his heart, which made them then do the angiogram where they actually can look directly into your arteries and see where the blockages are, as he described. So, so when we, well, let me go back to Frank for a second. Frank, it sounds like you were in tip-top shape. What are some things that you may have found out afterwards that put you at risk that you weren't even aware of?
Well, for me, it was going further into my family history. My mother, she battled diabetes, and she too had a bypass surgery. She also had a quadruple bypass surgery. However, it wasn't until after my surgery that I realized on my mother's side, I have 2 other uncles who've also bypass surgery survivors as well. But other than that, it was, still looking at maintaining those good lifestyle choices, being healthy, looking to eat better. But it was really learning more about my family history and now being able to impart that to my brother, my daughter, so that they can be aware of their cardiac health as well.
Mm-hmm. So yeah, I would imagine that you probably have spoken with your family extensively. Dr. Robinson, what are some things that put our heart at risk? Is it all genetics? Or are there, what is the role of genetics versus the things that we do on a daily basis that might be putting our heart at risk?
Okay. Can I touch on something that Frank mentioned about bypass? I don't want people to think that anytime you get an angiogram or a stress test, you're automatically going to bypass. So he mentioned the blockages in the different arteries. So when they did the pictures, if they saw one particular artery that had a blockage or a plaque in there, they could fix that with a stent and he would go home the next day. But if you had multiple big vessels that are blocked, then people tend to do better with bypass surgery, especially if you're diabetic. So I just want to clear that part up.
Thank you.
When you think about family history is usually the first degree male relative having a heart attack or stroke in their 50s, 55 or younger, and first degree female relative having their first heart attack or stroke before the age of 60, 65. When we talk about our relatives having heart attacks in their 80s, a lot of us, that same analogy about the plumbing, an 80-year-old house, you're going to have some plaque. So that's sort of not necessarily the family history component. The younger the people are in your family that have these events, that's when you start getting more risky and
more significant.
And more significant. So some of the things you can do, as he mentioned, lifestyle modification, that's a portion of it. I always like to talk about some of the things that the Heart Association looks at is health equity and the social determinants of health that actually play a role in how we eat, live, and how your zip code can dictate your outcome and how long you live. So those are factors that we really don't talk about that often, but things that people can do directly, be active like Frank did. And if he wasn't as active as he was, it could have been worse. It could have been, he could have had more damage to the heart muscle in that event.
Are there things like smoking though that put us at higher risk for that buildup of plaque and buildup of debris in the artery that leads to the blockages?
I always share my personal story. My mother died at 49 from smoking, from lung cancer. My sister, she smoked and had what we call peripheral arterial disease, right? PAD, where you get blockages in your legs. And most people don't know diabetes is the #1 cause of amputation and smoking is the second leading cause. So if you have blockages in one part of your tree, you might have it in different parts, like the roots of your tree are like your legs. The trunk of the tree is the main artery coming through your belly, and the branches are the arteries that go to your heart and brain. So if someone has plaque one place, you would suggest that there's somewhere else. If you see leaves falling off a tree, you might look at the roots, right? So smoking directly inflames not only the lungs, but also the blood vessels from head to toe.
Mm-hmm. And you mentioned diabetes.
That plaque sticks, and it's not just plaque, because the first, 20 to 30% of the people that come in with their first heart attack, if you looked at their cholesterol, you wouldn't necessarily start them on cholesterol medicine, right? So it's more than just your quote lipid or LDL or the lousy one. I like to tell people to remember it by. You want that less than 100 generally. The HDL or the happy one, that's the good cholesterol. You usually like it over 40 in men and over 50 in women. And the T for triglycerides or the trashy one, that's the fatty plaque, where you usually want that less than 150. So if you gotta make it simple for people to really understand and really know those terms that we're throwing at them.
Yeah. So cholesterol, we've talked about smoking, we've talked about diabetes. What about high blood pressure? Is that also a risk factor?
Well, high blood pressure, one of the biggest, I call it this, it's called the silent killer, right? So I see so many young African-American men that I see as a part of my practice for congestive heart failure, and it's the leading cause of congestive heart failure. Another analogy, if you're bench pressing, our heart pumps 20, 30,000 times a day. So that systolic blood pressure, the top number, is like when you're pushing the dumbbell up. That bottom number or diastolic number is when you're trying to bring it down. So imagine someone's still pushing down on the dumbbell and you're doing this all day. What happens to your muscle? It has to get thick to compensate for that. And if you keep doing that against higher blood pressure, it's going to get thicker. It's going to start breaking down, and then the stages of heart failure. All the arteries are like an onion. So if you cut an onion and they have layers in it, and it gets smaller and smaller as you get to the middle of that onion, and that artery gets smaller and smaller towards the middle as more blood pressure beats up on the muscles. So affecting the kidneys, affecting the brain, the back of your eyes. If you go to an eye doctor, they can look in the back of your eye and see if you have poorly controlled high blood pressure.
By looking at the blood vessels in the back of your eye.
Correct.
Wow. So that really kind of runs down the main risks for heart disease, um, or heart attacks, and that atherosclerosis, that buildup of debris and plaque, as Dr. Robinson mentioned, in your arteries. So Frank, when you went through your experience, what was the most helpful thing that you found in your relationship with your cardiologist after you went through this experience in terms of maintaining your health? What are some of the things that they told you that you found the most helpful?
And my doctor was Dr. Rajiv Patel, and he was and continues to be phenomenal in advocating for my health and lifestyle and keeping me on track. Uh, I think bottom line for me was his honesty. He was very, very straightforward in what they saw and what they didn't see, up until the point that we had the nuclear stress test, and once we had the stress test, went to a catheterization in order to find the other blockages, then continuing to walk me through, what was going to happen during the surgery, what my recovery would look like, uh, his recommendations during the recovery, in the 2-3 days after surgery, and then rebuilding strength in the heart, how much walking I should be doing, what type of physical therapy I should be doing, and then when would be a safe point to get back on the bike or do any other type of strenuous activity. So I think it's that honesty that starts, and it's building that trust with him as my cardiologist. And I'd also say, in my cardiologist, developing a good working relationship with my primary healthcare physician, so that they were able to share information, share data whenever I went for blood tests, ensuring that they were both able to share that information, and then develop a cohesive health plan for myself.
Great, great. And Dr. Robinson, in terms of other prevention, one thing we haven't really talked about is the role of stress. You talked about social determinants of health, things like being able to eat nutritiously, and have a balanced diet, being able to exercise, being able to know that you have enough money to pay for your medications, or um, keep the electricity on in your house so that you can keep your medicine cold, for example, if you have diabetes. All those things work towards keeping healthy. And if you have those things working against you, you have higher levels of stress in your life. So what role do stressors and the stress response play in accelerating buildup of plaque and increasing your risk for heart attacks?
Okay, I want to touch on something that Frank said just a minute ago to make it important to be an advocate for yourself. He talked about physical therapy, but if you've had a heart attack or congestive heart failure or a stroke, demand that you get cardiac rehab as well, right? So people that have had heart attacks, congestive heart failure, have heart surgery, they should absolutely get cardiac rehab. It's usually like 3 sessions a week for like 26 to 36 sessions. And I can't tell you how many of our folks don't get offered that. So you need to be, if you've had those things happen to you, I'm glad you had that experience, Frank, but in reality, my practice, we have probably like 15 different offices, and they're different types of patient population. Patient population at the hospital center, you may see a lot more Medicaid patients, sicker patients there, that some of those things may fall through the crack if you're not advocating for them. So as we talked about stress, there's a condition called Takotsubo's cardiomyopathy. And Takotsubo is Japanese for octopus pot, right? You see it shaped like this, and it bulges out at the tip. And that tip is like the tip of the heart muscle. And you see that most prominently in young women who've undergone a stressful situation, right? Some really intense stressful situation. And they come in with all the symptoms of a heart attack. The heart enzymes are elevated. You do the catheterization or angiogram that Frank had, and the arteries are completely clean. There's no plaque there. The theory behind that is the partial fight or flight response, or the adrenaline that causes those arteries to spasm. Just like things like cocaine is a stimulant that can cause a heart attack without actually having plaque. So stress, adrenaline, cortisol, all those things that are prevalent in our communities that, turn on our genes. something called epigenetics, right? So all you have to do is think about something that's stressful or painful, and it sets off that cascade of the hormone and the behavior itself, where your heart's racing, your blood pressure's going up, you can't sleep, you have ulcers. So all of those things can directly impact.
Yeah. So mindfulness, meditation, those things help to bring down blood pressure, which in turn helps to lower your risk. Getting enough sleep, if you can, also very important in helping to lower your cortisol levels, your stress levels, to decrease that inflammation that may ultimately lead to blockages of the artery. I can't believe we have so much more to talk about, but it is time to bring in our audience questions. Welcome Wayne and Larisha back. I almost said LaWayne. Wayne and Larisha back into the studio.
He is a world-renowned artist in his own right. People may not even know that about Wayne. He is a world-renowned jazz musician.
Yes, he is.
We don't talk about it here. We don't talk about it. We don't talk about Bruno. We don't talk about Bruno, Dr. Robinson.
But you have many hats, so that's okay.
Well, it's part of my my health plan. I mean, it is a stress reliever right now. So it's just so much. Larisha, you have any questions?
I do. Dr. Robinson, you mentioned cardiac rehab. What specifically is that, and what does that consist of, or what is that inclusive of? Or is that something that you, I guess, judge or go with on a case-to-case basis?
So we refer out to cardiac rehab. There are specialty centers all around. There's one over at Trinity that's a part of MedStar. There's up in Suburban, or all over the city. But with COVID, there was a backlog, of course. So people are still slowly getting in. There's multiple indications for referring someone to cardiac rehab, and asking your doctor to refer you. If you have congestive heart failure, your heart pumping function is less than 35%. Normal is 55%. If it's under 35%, you would qualify for cardiac rehab. If you had a recent heart attack or bypass surgery like Frank, you would qualify for cardiac rehab. And it's structured exercise. So not like you're just running out and starting to do your own thing. There are people that are experienced with heart patients and showing them to give them, quote, an exercise prescription. So that once they're done, they can go home and continue doing it and improving upon that. So it's usually about 3 days a week. I believe it's either 26 or 36 sessions that they go there, monitor, their blood pressures monitored, their weights monitored, and they get feedback. So Frank may want to comment if he had that experience.
So, and yes, I was about to jump right in there. Yeah, I called it PT, but it was in fact cardiac rehab. 3 days a week. I was there Monday, Wednesdays, and Fridays. I think within 2 weeks after my surgery, and it consisted of treadmill work. They had stationary cycles, fully connected to portable cardiac monitors, so they can monitor my heart rate throughout the session. They as mentioned, monitor my weight, blood pressure, and all my vitals during the workout. And in addition, they also allow you to do lightweight training as well, because after surgery you may not have been as active. So lightweight training, cardiac work on treadmills, spin cycles, and just looking to ramp up and monitoring progress. And it's always a bit challenging when they say, Frank, you're doing too much here. You're way too good at this. But it was good to know that I was making progress and met their expectations.
And I want to just highlight one thing that Dr. Robinson said earlier, because we're here to empower people. A lot of times, or sometimes, occasionally, certain patients won't be recommended for cardiac rehab, even though they meet the qualifications. That's one way that you can advocate for yourself or your loved ones by, if they've had a heart attack or meet any of those criteria that Dr. Robinson said, to make sure to ask for cardiac rehab if that hasn't been prescribed.
There's a documentary that the Heart Association put on with another company, and they followed 5 people around the DC area and their stroke recovery. And you can imagine the outcome. Those that lived in certain portions of the city versus others had much better outcomes when you looked at putting them into physical therapy and cardiac rehab.
So,
Yep.
so you're saying that if you have more money, is that what you're saying? If you have more money, you have a better chance of better outcome. If you live in a better neighborhood, I mean, and not just in Washington D.C. area. I'm just as
Across the country.
across the country.
Yes, there's this Time magazine article. Anyone of you guys can look it up. It looks at how zip code determines your outcome.
Oh, wow.
And there's a guy that does these maps. He did one of DC, did one of Chicago, and did one of New York City. And you hover over each zip code. So if you go from Southeast DC, you might have a life expectancy somewhere in the 60s or 70s. You go upper Northwest up into Ward 1, you might have an average life expectancy in the 80s or 90s. I mean, we're in the same city, right? So there's something when you look at when you hover over each one of those zip codes, there are parameters that are broken down. Elijah Wolfson is a guy that did these maps, and he looks at insurability, access to food, educational level, all of those things. Those are the social determinants of health that are actually the base of the pyramid. The stuff that we've been talking about is that peak of the pyramid. That's why cardiac disease has still been the #1 cause of death since 1918, right? Because we haven't really invited all the right people in the room, like legislators, to really talk about how important it is to change some of these other things that a physician can't do at all.
And some of the stressors that result from living in certain zip codes, where you're not getting the food that's needed to repair your body because there's a liquor store on every corner and a corner store that doesn't have healthy produce, or the fact that unemployment is high, or the fact that they're 75% Black men are 75% less likely to have health insurance than white men. All these things lead to poor health outcomes. And I think we see it in heart health, just to echo what Dr. Robinson was saying.
And you can't tell people to go out and take a walk if they're scared to go out and take a walk. You talked about health access. Washington Post published an article just the other day that talked about tying Medicaid to work. So we all know how that's going to turn out. If you have Medicaid, you're usually the sickest of the sick. And how are you going to go out and get a full-time job or volunteer 80 hours a month if you're hooked to oxygen or you can barely walk and you're tying someone's access to Medicaid? So that's where, when I mean looking at bringing other people in to try to help solve this problem and being vigilant on what's happening.
All right.
We have a question from Marv West. Marv asks, how do you know to ask for rehab or anything else when you're a layperson?
Well, I mean, you may not really. That's why we're doing these kind of forums, right? So there are specific questions, and your doctor should really advocate for you. One, if you had congestive heart failure, the function of your heart's less than 35%, you would qualify for it. If you had a stent or a heart attack recently, you would qualify. Not if you had a stent a year ago, you sort of missed the boat on that one. If you have active symptoms like that, if you had recent heart surgery, you should be referred for cardiac rehab.
As another question, follow-up question, is pulmonary rehab the same as cardiac rehab?
Well, they do a little different in focus. When you look at pulmonary rehab, you're looking at patients that may have emphysema or scarring in the lungs, or what we call COPD, or you might look at someone that has pulmonary hypertension or high blood pressure in the lungs, and there are a bunch of different things that can cause that. So they focus on trying to expand the lung volumes and expand, they may do something like what we call a 6-minute walk and try to focus on the lung capacity versus the overall heart capacity.
But the overall idea of physical rehab specifically to help that organ and your functioning is the same.
Is key, is important.
Yeah.
Yep. So
I would like to go back to you, Mr. Frank, specifically talking about your mindset, your mentality as you're going through this type of process. Patience, I feel like, is a huge component to all of this. How are you able to, I guess, maintain a positive attitude and know if I, maintain or be steadfast in this, that I'll make it and I'll get back to maybe the way I used to be a little bit, even if it's not quite there, but I'll get back to some point. How are you able to maintain and, withstanding your patients?
Great question.
Yeah, that is a good question. And once again, for me, I think it's twofold. It's one, having those conversations with my cardiologist. Can I get back on the bike? Because there is going to be that initial psychological barrier. You worry, well, am I pushing myself too hard? Am I going to create another cardiac event if I try to do too much too soon? There are those normal psychological barriers whenever there is a health scare like that. You hear NFL players worried about making that one cut that might blow their knee out again. It's very, very similar. So it's having those honest conversations with me, both with my cardiologist, my doctors, as well as setting those small goals myself. I do tend to be a bit of a type A personality. For me, as I think back, it was setting a goal to do another Tour de Cure, which I did in September of 2017. I did another 20-mile bike ride by September within a number of months after my bypass surgery. So for me, it was setting those additional goals, making sure I was on track to not exceed what my cardiologist or my primary healthcare physician felt I needed to do and hit those milestones. And then just try to keep the negative thoughts at bay with my cardiologist and also my family. I had a ton of support from my family and also my fraternity brothers.
And the last thing for me, and this goes for both of our guests, is there a specific message that you would want Black men or Black women to really take away from our conversation tonight? If so, what would that be?
From my standpoint, it's pay attention to those small signs. Stay in touch with your primary healthcare physician about your numbers. Know your numbers. Blood pressure. Get those blood tests as needed. Stay on top of your health. Do a little bit every day to be sure that you're maintaining your cardiac health. Get those steps in. Get that Fitbit. Whether it's cycling, whether it's running, whether it's walking, do something to help with your cardiac health.
Great advice. Dr. Robinson?
So I always tell my patients TLC. So if people heard me talk, I talk about TLC, or they'll say, what is that tender loving care? No, it's total lifestyle change. So there's no quick Ozempic that's going to fix it. There's no meditation's going to fix it by itself. There's no quick fasting that's going to fix it on its own. It's a total lifestyle change. And trying to help people focus on doing that total lifestyle change is going to be important. Another analogy I like to use is I ask my patients what kind of gas they put in their car. And most of them like, well, if they have a nice fancy car, they're going to put high test. And I was like, well, just put diesel in it. Don't worry about it. And then they look at me like I'm crazy. I'm like, why would I put diesel? The car says I need to put 97 grade. And then they were just fussing at me about me telling them to limit the amount of carbs that they put in their body. And they don't get it until I say, you care more about your car than you do about your body. So you're putting diesel in your body and not in your car, because if your car's messed up, you can't get around. But if your body's messed up, nothing else really matters.
Wow. That is a place that is a place to end it, unfortunately.
Yeah.
But that is excellent advice and an excellent analogy. And TLC, put what you need in your body. Take better care of your body than you take of your car. And know your numbers. Like Mr. Frank said, know your numbers, keep on top of it.
Data.
Do that extra little bit every day. Yeah.
Have all the
Total
data.
lifestyle change.
Yeah.
That's
Well,
right.
thank you all so much. This was just an excellent review, understanding of heart health, preventing heart attacks, being on top of your heart health. Thank you so much, Dr. Reginald Robinson. Thank you, Mr. Frank Griffith. You all were incredible. And I think it's time to get back to that. See, do we have anything in the chat about what y'all think?
Oh, what y'all think? Hold on.
What y'all think?
So the biggest what y'all think. The biggest what y'all think was this. Look, it's only one person that needs to say this. And what y'all think, I can't pronounce Getachew is the last name. But they said no, and no.
So they're
we
the Wayne
are
Bruce
not
School.
eating lab chicken. And I'm quite sure the cardiologist, Dr. Robinson, would tell you, do not eat the lab chicken.
Total lifestyle change. No lab chicken.
Total lifestyle change.
Would say, there are some cardiologists who would say stay away from meat altogether. But, I say moderation. But, well, that's good to know. It sounds like Mr. Getachew spoke for quite a few people. Would that be accurate to say?
I think so, because it's a no. It's a no.
No.
NAWL? No.
That sound like a no. Sound like a song.
Wow. Well, on that note, thank you all for what y'all think.
What y'all think?
Thank you. Thank you, Wayne and Larisha, and thank you to the audience for putting those incredible questions in the chat and following along with us. We love you. And I also wanted to just remind you that there is still a chance for you, my Be Health Empowered family, to participate in that special research study at Howard University. They've asked me to ask people to participate in the COVID resilience research study done by researchers at Howard University. It only involves filling out 2 surveys. That's all you need to do. And you're eligible for compensation for up to $100 for just filling out those 2 surveys. If you have any interest whatsoever and just want to find out more, contact Dana Harvey at her email address, danaharveyresearch@gmail.com. That's DANA Harvey, HARVEY, research@gmail.com. Well, that's it for us tonight, y'all. I really appreciate y'all for being here. And remember, if I don't see you again till next week, remember, be wise, be well, and be health empowered. Thanks for joining.
I guess I should thank the Robinsons. They invited me. They still don't know. I hooked up with Dave 3 days ago. He'll start coughing tomorrow. And I bet in 10 days he'll be on a ventilator. Now his wife, she's not vaccinated because she thinks it'll prevent her from being pregnant. But what they don't know is that I can decrease sperm count. Sorry, Dave.